Hi everyone, welcome back to my channel. Today we are going to learn one of the most frequently asked and most interesting topics, scope of psychology. Yes, this question always finds its way into the exam paper. So let's not just study it, let's master it with examples that you will actually remember. So let's get started. Let's start with the basics. Psychology is the scientific study of human behavior and mental processes. In simple words, it helps us understand how people think, feel, and act. Now imagine this. A patient is about to go for surgery. He's scared, anxious, and sweating. And you, the nurse, smile, hold his hand, and say, "You're going to be absolutely fine." That's not just care, that is applied psychology. You just reduced his anxiety using empathy and reassurance. When we say scope, we mean how wide this field is where psychology can be used or applied. And trust me, psychology is everywhere, in hospitals, classrooms, industries, sports, and of course, in nursing practice. It helps us understand patients better, communicate effectively, handle stress, and even manage ourselves. Now, this is the heart of the answer, and it is very scoring. You can divide it into two parts, pure psychology and applied psychology. Think of it like theory and practice. One helps us to understand and the other helps us to do. Pure psychology is the theory side. It explains why people behave the way they do. Before we can help anyone, we first need to understand how the mind works, and that is exactly what pure psychology teaches us. Let's begin with general psychology. This branch studies the basic mental processes that we use every single day, like learning, memory, attention, and perception. Think about nursing practice. When you learn a procedure, remember drug dosage, or recognize a patient's symptom, you are using learning and memory. Even perception is important. For example, noticing a patient's facial expression or body language. So general psychology forms the foundation of all other branches. Now that we understand the basic mental processes, let's see how these processes change as a person grows. Developmental psychology focuses on human growth and changes from birth to old age, physically, emotionally, socially, and mentally. For example, a pediatric nurse knows that a toddler cries during injections not because of bad behavior, but due to fear and limited understanding. Similarly, an elderly patient may become slow or forgetful because of age-related changes, not stubbornness. Understanding development helps nurses give age-appropriate and compassionate care. While some changes are normal, sometimes behavior becomes disturbed or unhealthy. This leads us to the next branch. Abnormal psychology deals with mental disorders and unhealthy patterns of behavior. Conditions like depression, anxiety, schizophrenia, and bipolar disorder are studied under this branch. For a psychiatric nurse, this knowledge is essential. It helps in identifying symptoms early, understanding patients' behavior, and providing care with empathy instead of judgment. So, we treat the person, not just the illness. But human behavior is not only influenced by illness, it is also shaped by people around us. Social psychology studies how a person's thoughts, feelings, and behavior are influenced by family, society, and culture. For example, a community health nurse may notice that some families refuse vaccination due to cultural beliefs or social influence. Similarly, a patient may follow treatment better when family support is strong. So, social psychology helps nurses understand why people behave differently in groups. Now, let's go deeper. What happens inside the body that influences behavior? Physiological psychology explains how brain, nerves, hormones, and chemicals influence behavior and emotions. For example, during stress, the body releases stress hormones like adrenaline and cortisol, which can increase heart rate and blood pressure. That's why nurses manage stressed patients calmly, knowing that their behavior has a biological reason, not just attitude. So, when we combine all these branches, we get a complete picture of human behavior. To summarize, pure psychology helps us understand how and why people think, feel, and behave the way they do. It builds knowledge and understanding but does not directly focus on practice. Once this foundation is clear, we can apply it in real life situations, and that brings us to the next part. In the next video, we'll discuss applied psychology, where psychological knowledge is used in hospitals, schools, industries, counseling, and daily life. So don't miss the next part. If this video helped you to understand psychology in a simple way, please like, share, and subscribe. Thank you, and I'll see you in the next video.